When COVID hit, the world stood still. Every precaution imaginable was put into place to save lives. But consider this, since 2020, nearly 1,500 people have died in King County alone, not from COVID-19, but a deadly dose of fentanyl. And it only takes this much to be lethal. Most communities are experiencing a surge in fentanyl-related deaths right now. It's especially bad in King County. In 2019, an average of 3 lives were lost every week because of a fentanyl poisoning. As we speak today, the number has skyrocketed to more than 20 deaths a week in King County because of a fentanyl poisoning. It doesn't discriminate against age, race, or a pre-existing condition. I spoke with 5 families who lost a child due to a fentanyl-related poisoning. They want the world to know this is not an overdose problem. What a beautiful picture.
She was a beautiful girl, inside and out.
This is Sophia.
Trey, my beautiful Trey.
This is Brilliant Lawson Lynch.
Lucas is my younger son.
Well, he was my firstborn. He was the best big brother.
She was witty, she was funny, really kind.
Lucas was kind. Lucas had lots of friends.
He was a musician, so that's why I brought this picture, because he was in his element here.
She was 20 in this picture. This was taken just a few days before she passed away.
I lost her 6 days after she turned 18.
He was 21, so.
I would not think of Lucas being a depressed guy.
I never imagined that we'd lose her first.
He got a Percocet from an acquaintance, and it was not a Percocet. It was completely fake with fentanyl and fillers, and he died in his sleep.
And my husband and I were both, what is fentanyl?
How does it feel to be around other moms like this?
It's like,
They're the only ones that know how we feel.
it's like you're in this new club now that you never wanted to be in.
Yeah.
It's a horrible club, but you find bonding.
5 mothers, just a fraction of the families left struggling to make sense of it. Their children, Brilliant Lynch, Sophia Humphreys, Trey Schweigert, Jalen Penix, and Lucas Bier, all thought they were experimenting with a single dose of the painkiller Percocet, but in fact the pill was unknowingly laced with the synthetic opioid fentanyl. But I don't get the sense that any of your children had a drug problem.
She was doing great, and this was just, a moment.
He got on Snapchat, ordered a Percocet. They brought it to his house, gave it to him, and he died that night because it was straight fentanyl. That was the only thing in his system.
Yeah, same for my daughter. When they did the toxicology, there was so much in there that the prosecutors thought it was an error. There was enough to kill, I think, 3 dozen people or more.
Like 2 years ago, meth was still #1, but now meth is not even there. It's just all fentanyl.
Lab tests now reveal 6 of 10 fake prescription pills flooding our communities are laced with a lethal dose of fentanyl, 100 times more powerful than morphine. Just a small pinch hidden inside can cause an overdose.
People hear overdose and they picture someone in a back alley with a needle hanging out of their arm, dying because they took too much drugs. This is a poisoning, so it needs to be called what it is.
This is the most serious threat that we faced, and I've been on with the DEA for 25 years.
DEA Special Agent Jacob Galvan says the problem starts with drugs being shipped from China to Mexico, where the drug cartels then flood it up the West Coast.
All they care about is making money. They want to drive addiction. The more people they can get addicted, the more drugs that they can sell, and that's all they care about. And they don't care who they harm, they don't care who they kill.
But the poison pills keep coming. The DEA says drug busts are up 146% today. And last year in the Northwest alone, agents seized 8.9 million deadly doses of fentanyl. So you've seized enough fentanyl to kill every person in the state of Washington?
Yes.
That's terrifying.
Yes.
Think about that.
Yeah. And that's why we need to get this message out.
He says schools play an important role in getting the message out there. The Tahoma School District in Maple Valley is one district sounding the alarm to do more.
I'm seeing the families want education because they're worried about their kids.
Liz Thilbert is the district's new wellness coordinator. Her job is to connect the schools and city leaders to keep families on alert about the way one pill can kill and streamline resources for mental health and substance abuse. Congressional leaders have also zeroed in on this community to help prevent teens from making that one mistake. and staff in middle school and high schools are fully stocked and trained on how to use the overdose reversing drug Narcan, although it hasn't been needed yet.
We're going to work with parents, we're going to work with our community, because this is a community issue. It's not just a school or a community or a parent, it's all of us together working to create change.
Do you think the schools are doing a good job?
I think they're starting to, yeah. And we would always like to help them.
I think education needs to start even as young as middle school.
Middle school, yeah.
And start telling the kids about it right away.
Yeah, it needs to come from all directions. And I think
Yes.
I'd personally like to see a statewide mandated awareness campaign. Start those conversations, because there are drug dealers
At
in
a young
schools.
age.
What should they be watching for?
And parents need to know that it can happen to them. Even if you're a helicopter mom, your kid will still go and experiment with drugs. And some of these kids are dying just from experimenting one time.
5 moms still struggling with the pain and left wondering if change will ever come.
I want to help another family not go through what we're going through. I have to do something.